Our second interesting abstract at ASCO 2025 was presented by first author Dr. Ali Arafah, and this was a prospective biomarker study where we collected blood specimens from 100 consecutive patients who were eligible for lutetium-177 PSMA-617. The study was designed to assess the circulating tumor cell PSMA positivity and the PSMA protein detection in extracellular vesicles, also known as EVs. So let's talk about the first part. At baseline, in the patient's blood sample, those patients who had a high abundance of circulating tumor cells that expressed PSMA on their surface, in other words, PSMA-positive circulating tumor cells, a higher number of those was paradoxically associated with a unfavorable overall survival to lutetium-177 PSMA-617. So more CTCs that express PSMA, potentially as a measure of increased tumor burden, those patients will do worse on lutetium PSMA-617. The second thing that we did was we developed for the first time a blood-based EV proteomic analysis using a method called shotgun proteomics using mass spectrometry, where we could identify in blood more than 10,000 unique EV-related proteins, including PSMA and some other of our favorite cell surface targets in prostate cancer, such as B7H3, TROP2, and also STEAP1. So first focusing on the EV detection of PSMA, patients that had blood-based EV high detection of PSMA at the protein level also had an inferior, worse survival to lutetium PSMA-617. And interestingly enough, a number of other cell surface proteins, which are sometimes called the surfaceome, also correlated with a worse survival as well. And those proteins included STEAP1, which is a androgen-regulated protein, B7H3, which has been of great interest recently for multiple therapeutics, and also TROP2, which has also been the target of some antibody-drug conjugates. So higher expression of PSMA in the blood derived from EVs associated with worse prognosis to lutetium PSMA-617, and that worse prognosis was also found with high EV TROP2 levels, high EV STEAP1 levels, and high EV B7H3 levels. In the future, we hope to be able to use a blood test to not just understand the number of circulating tumor cells, but also to quantify prostate cancer relevant proteins, including cell surface proteins, in the prognosis of prostate cancer in the context of various systemic therapies.